Okay, good afternoon, everyone, and thank you for attending the Adelphi New York Statewide Breast Cancer Hotline and Support Programs, the benefit of integrative medicine, the use of acupuncture, acupressure, and physical therapy to help ease the symptoms of breast cancer. My name is Nina Foley, and I am a social worker and the volunteer and hotline coordinator of the Adelphi Breast Cancer Support Program. Thank you for joining us. We are so grateful to have two experts in the field of integrative medicine here with us for our lunchtime forum. I will introduce them in just a moment. I wanted to let everyone know that this program is being recorded and you will be able to watch it in the future, as well as our other past forums. If you visit the website breast-cancer.adelphi.edu, you can see all of our past forums, and this will appear in a month or so. At the end of the program, if time allows, we will hope to allow the audience to ask questions of the participants. Please enter any questions that you have in the chat, and we will monitor them and let you know towards the end if we will have time to ask and answer questions. I wanted everyone to know that the Adelphi Breast Cancer Support Program is here to offer free and confidential social work support, peer-to-peer support, and resources to anyone impacted by breast cancer. It is my pleasure to introduce Dr. Ying Zhu, who will be discussing acupuncture and acupressure, and Soy Joe, who will talk about how the use of physical therapy can help breast cancer patients recover from the side effects of treatment, especially with lymphedema. I will now tell you about their biographies. They're both very impressive women and very accomplished, and we're very grateful to have both of them here today. Soy Joe received her doctorate in physical therapy from Boston University in 2009 and her master's of science in physical therapy from Husan University in 2005. Soy is a licensed physical therapist, board-certified clinical specialist in oncological physical therapy, and a certified lymphedema therapist. Soy's diverse experience is highlighted by 15 years at Mount Sinai Hospital, where she was a leader of the lymphedema and breast cancer rehab program, and Northwell Health STARS rehabilitation. Soy's clinical focus lies in upper and lower extremity lymphedema. Additionally, she is a member of the American Physical Therapy Association and the National Lymphedema Network. Next, I'm going to read Dr. Zhu's bio as well, but Soy will be doing the presentation to start with, and it will be followed by Dr. Zhu. Dr. Ying Zhu is a board-certified physician in physical medicine and rehabilitation. After graduating from Rutgers, New Jersey Medical School, she completed a residency in physical medicine and rehabilitation at NYU Grossman School of Medicine. She then went on to receive further training in cancer rehabilitation at the University of Miami. She currently practices in New York City at the NYU Langone, where she sees cancer patients in the entire continuum of care, from recent diagnosis to survivorship, and works to optimize patients' quality of life. I can't thank both of them enough for being here. And in one moment, I'm just going to share my screen, and Soy is going to do her presentation from her, hold on one second. Can everyone see that? Okay, go ahead, Soy. Thank you so much for being here.
Hi, my name is Soy. Thank you for having me today. So today we're going to discuss about the benefits of integrated medicine for breast cancer rehab history and then the lymphedema therapy. Next slide. So for the cancer rehabilitation, I just wanted to go over what the cancer rehab is. It's defined as helping people with the cancer to help them to obtain the maximum physical, social, psychological, and vocational functioning within the limits imposed by disease and then its treatments. Next slide. So this is a kind of after you guys feel after the post breast cancer treatments comorbidity, such as post mastectomy pain, which is very common, and lumpectomy pain, and then a lot of stiffness after the surgeries. The coding, which is a official name, is axillary web syndrome. So basically, onto the right side on the upper picture, you're gonna see the little pores. So sometimes after the removing the lymph nodes, sometimes the lymph nodes pop out, and then they see just like looks like a guitar string. That's what they usually put as the axillary coding, which cause a lot of pain, a lot of tightness, decrease your range of motions, also burning pain, and then also they have a limited range of motion that they couldn't doing a lot of activity daily livings. And then also the scar tissue fibrosis, which is patients have after the radiation therapy, that the tissue gets very hard or gets very tight, that they all which is decreases their range of motion as well. Of course, they present with the weakness, fatigue, restrict range of motions, weakness score after the reconstructive surgery, the protect posturing, and then also the breast and upper extremity lymphedema. So the fatigue is coming from the mostly patients for going through the chemotherapy. And then they severely get a fatigue about it, which is actually the therapy can help out to improve their fatigue and then the functions. Next slide. So this is a very briefly just talking about the dysfunction that going through it, and then the stretching exercise is very important, because once they doing to the surgeries and then the scar tissue build it up, and then they're going to the radiations, of course the radiation fibrosis, which is very tightness, and then start to doing the stretching exercise is very important. And then so that's what we really focus in our clinic as well for the breast cancer rehab. You can start to do this kind of stretching exercise, which is first is a hands on the behind your head. So basically bring your hands behind your head and then do the stretchings to improve their posture and then decrease their tightness. The second one is also hands over the head, which means, bring your hands over the head, and then they will help out to decrease their tightness in a lateral chest wall area, which is under their side trunk, and then also will help out to decrease their tightness on their core area after the breast reconstruction surgeries. Another cause is open book. I'm sure a lot of people who went to the physical therapy, they've been doing this type of exercise, which is really help out to open up their pec muscles, which is on their above the muscle in the breast. And then they will really help out to improve their range of motion as well. And then the last picture is, kind of a manual technique for the cordings. So basically we compress the cord to stretch it out to the pores to decrease the pain and then tightness, which will improve their range of motion as well. Next slide. So once we improve their stretchings, once they improve their range of motion with the stretching exercise, we're going to move on to the strengthening exercise. We start with a very gentle range of motions, whatever has the shoulder flexion, abductions, external rotation, which means all required for the doing in a functional activities, such as reaching over, put the shirt over, liftings. And then we also work with a lot of different types of the muscles on their shoulder area and then scapular area, which will help out to improve their range of motion as well. So the core strengthening is very important. Patients who go into the reconstructive surgery, which is I'm sure a lot of people heard of the dip flap, which is a very common reconstructive surgery right now that they're doing it. So that can cause the instability of the core. So we really work on to loosening up their tightness on the abdominal surgery area, and also improve their core stabilization exercise, which is they can start to do Pilates or yoga. Also, another thing is that the scapular stabilizations. And also, we work on to the lower extremity, which is their legs, cross chain exercise, which will help out to improve their fatigue level as well, going through the chemotherapy. There's some precaution that they have to going through, and just be careful about when you're doing an exercise as well. You always have to consult with the surgeons before performing the exercise, because some certain doctors have a protocol after the surgery, or after the chemotherapy, they have to make sure that their blood count level is stabilized to doing an exercise as well. So just make sure they consult with the doctors first before you want to do any exercise with them. And then check the range of motion restrictions. Again, this is just a follow after the more post-op surgeries. And then we just have to review the purpose of performing the exercise, just to help the improve the range of motions. And then after the surgeries, and then we're going to start with a lot of breathing exercise, which will help to relax it, and then ease to discomfort, and then the tightness. Also, that breathing exercise will help to improve their lymphatic systems, and then open up the lymphatic channels, start to do some exercise as well. And then once they start, stop the exercise, if they have any pain or tightness or pulling sensation can increase, then they should stop the exercise and then get rest first. So next slide. Actually, before that slide, there's another slide.
Yeah. Oh, I'm sorry.
That's okay. So let's go over some lymphedema. Lymphedema condition is very common after the breast surgeries. Not everybody gets a lymphedema, but some people will get the lymphedema. So it's important to aware of what the lymphedema condition is. We get a lot of question about am I having lymphedema? Like, a lot of patients are concerned about the lymphedema. So I think it's very important to know what the lymphedema condition is, and just get to know about what they have to watch out the signs or symptoms. So what is a lymphedema? Lymphedema is an abdominal collection of a high protein fluids that underneath the skin. So this can occur mostly in the arms, leg, but it also can occur to other parts of their body, such as the breast, the trunk, head and neck, or general area. So basically, breast cancer patients mostly get from their arms, because they remove the lymph nodes under their armpit, which is axillary lymph nodes. And also, patient can get the lymphedema in the breast area as well. I've been seeing most of breast lymphedema is a patient who went to the lumpectomy and then going to the radiations, and then they tend to get the breast lymphedema. Next slide. So I just wanted to go over, this is kind of overview of the whole our lymphatic system. So I get a lot of patients like, what is the lymphatic system is? So lymphatic system is, it's a circulatory system. It's in our body as well as our immune system. So lymphatic system has two functions, which is a circulatory and then the immune system. We have in our body, we have a 600 to 800 lymph nodes entire our body. So even though they removed some lymph nodes from the surgeries, they still some lymph nodes are intact and now under their armpit. So this is all our body, and then that's how we work through with our lymphedema therapy. So you have a major lymph nodes around your neck area, around your trunk area, going down to your inguinal lymph nodes, down to the legs, so there is the entire body, and then it's connected to the lymph vessels, and then it's very similar to the blood circulatory that they circulate to all our bodies. Next slide. So these are kind of common signs and symptoms of getting a lymphedema. So basically, you're going to see very visible swelling in the extremity or area that you had the surgeries. Lymphedema, it's not painful, but sometimes when when they get swelling, the skin gets stretches out, then it can be a little painful from the more like a skin pain. But actually, lymphedema itself does not have it's not painful. Diagnosis or any, it's not painful at all, but they do feel the heaviness because of the, it gets other arms gets bigger, so they feel that it's very heavy because of the accumulating fluids. And then the swelling does not go away to the any elevation or whatever they're doing it, the swelling is not going away. So it's a more gradually, the swelling is getting worse and worse. No matter what they do, if the swelling is persistent, and that's kind of lymphedema condition is. Next slide. So this is our view of the lymphedema therapy. Official name of the lymphedema therapy is complete decongestive therapy. So basically, there's a two phases. Phase one is a decongestions. So basically, we have, they come in for therapies, and then they have to decrease their swellings manually. So we do the lymphatic manual drainage, which means we manually open up the lymphatic channel, try to push the fluids up by very light massage. So it's called so basically patients will get the little lymphatic massage on their arms to decrease the swelling. After we decrease the swelling with the manual lymphatic drainage, we're gonna go on to the multi-layer bandagings, which means basically we have to apply the compressions. So it's a multi-layer bandaging is we are using different types of the short stretch bandages to apply the compressions as a gradual compressions to decrease the swelling and then push the fluids out. After that, we perform the exercise with the patients. So of course, patient will educate about the skin care, wound care, how to take care of their skins. And then once they see the good reduction of the swelling from the phase one that in physical therapy clinics, and then they're going to move on to the phase two, which is a maintenance program. So we work with the patients to get them the proper compression sleeve or compression glove, gauntlets. And then we also teach the patients if they want to one is a self-lymphatic manual drainage, which is the patient how to performing. And then we also we educate about skin care, wound care, and then there's certain specific exercise that they have to performing it to maintaining their swelling down with it. So let's go over some compression garments. Next slide. So these are kind of compression garments that they're going to go over with it. There's a day garments and then there's a night garments. So day garments is maintaining reduction has been made throughout the phase one in the clinic. So it must be worn all the time to prevent the swelling. The compression is going to be the key. If there's no compression, the swelling will come back because unfortunately lymphedema is a chronic conditions. So they have to wear the compressions as much as possible to maintaining their swelling down. There's all different compression classifications, 20 to 30, 30 to 40, 40 to 50. We typically suggest the patient to wear 30 to 40. That's a kind of standard classifications for the lymphedema patients, but again, on patients unable to wear 30 to 40, we can bring it down to 20 to 30, or they have very mild swelling, then definitely they can start with only 20 to 30 compression first, and then see how they like it. It's better to wear something than not wearing anything. So it comes with a different color, as you see all the pictures. It must change every 6 to 9 months because it can, be very loose. Then what happens is between their arms, and then there's a compression, there's a it can be increased space, then eventually their swelling will come back again. So it's important to keep changing their compression sleeve or gauntlets or glove every 6 to 9 months. So insurance sometimes cover, sometimes not. Starting this year, the Medicare will cover the compression sleeve and the compression garments, which is very, very good news. They've been working for over 10 years to fight with it, and then finally Medicare agreed to cover it. Medicare usually cover for 80%, and then whatever they have a supplemental insurance will pick it up to 20%. Unfortunately, Medicaid is still not covering any compression garment, or patient who has supplemental Medicaid insurance, there's a possibility that it may not be covered. So, definitely you guys have to check with the vendor to, see if the insurance will cover the garment. Next slide. So this is the night garment that people can get it. So night garments, it's a very similar concept of the multi-layer bandagings. It's easy to don and doff, and then it's a washable. It's already built in the pressure system. Unfortunately, it's more expensive, but it lasts about 2 to 3 years. So basically, rather than wearing a compression sleeve or gauntlets during the night, it's because sometimes it's not breathable. So, we switch into the night garment. It's much easier. They can adjust the compressions, whatever they able to tolerate it. And then it helps to actually the night garment can help to decrease swelling a little bit more at night. So there are a lot of different types of it. There's a pull-in, there's a Velcro style, which is very, very popular. It's easy to don and doff. And then also, as long as the Velcro is pretty good, then it can be used about 2 to 3 years. So, unfortunately, it's expensive garment. but it's a good investment that they're able to keep the swelling down at night as well. Next slide. So risk factor, the prevention. So whose risk of lymphedema? Of course, history of the cancer treatments, venous insufficiency, obesity, history of the wounds. It can be, risk of the lymphedema. But as I said, not everybody get the lymphedema, even though they had the breast cancer surgery. It just depends on the patients, and then depends on what cancer treatments they're going through with them. So unfortunately, you can't 100% prevent the lymphedema from the developing, but you can observe the following the precaution, and then decrease your risk with it. So and now so risk aware of the signs and symptoms. As soon as like you guys know about the any symptoms, definitely discuss with your oncologist or surgeons. Just make sure that your swelling is persistent and then it's not going away. Okay, next. So this is a healthy habits for the patient risk of the lymphedema. Basically healthy habit is going through a lot of a lot of my patients asking about, oh, can I take the salt? Should I also avoid the salt or anything? Maybe I mean, from the book says that to kind of try to follow the Mediterranean Mediterranean food, such as more eat pretty much it's all healthy food that you can follow with a lot of veggies. Make sure that you're hydrated, and also just watch out not to take too much salt, and then all those things will help out with it. And then also the skincare is very, very important, because once you notice any like a cut or anything like that, or some mosquito bite can cause the actually develop the lymphedema as well, because it might be going to the infections. Then they're getting some swelling as well. So, and then watch out any cellulitis, which is a lot of patients get a lot more swellings after the cellulitis. And then make sure that put the good lotions, keep your skin not too dry, and then put some lotions, and then watch out any cuts with it. Also, you have to check with any medical checkups, so follow with your doctors. And then if you notice any swelling, then definitely ask your doctor about to coming refer out to the lymphedema clinics. And then again, it's an infection education about it. Next slide. So try to avoid the possible triggers, which is injury or trauma can cause the swellings as well, or any limb constriction. So basically any tight underwear or a tight bra can cause the swellings. And then also any extreme temperature. So once the swelling sometimes gets worse with any heating pack, any sauna, jacuzzi, anything makes you hot can cause some more swelling. So just have to be try to avoid the extreme temperature. And then prolonged inactivity, which is sitting a lot, make sure that you get up and then walk around. Or if we do a lot of computer work, make sure that stop every an hour and then do some stretchings, because that will help out to open up the lymphatic channel, and then improve the stimulations over lymphedema conditions. Okay, next slide. So this is our offer to all our clinic in the breast cancer therapy. So we really specialize in the breast cancer rehab, which is we are all certified as breast cancer rehab therapists. So we went to special trainings. We really overall working with a lot of plastic surgeons, and then breast surgeons, and then oncologists. We work it out to help that our breast cancer patients. So this is all our location throughout to the entire of the Suffolk County, Nassau County, and the Queens. So if any questions, feel free to ask me about the questions about it. We work with the patients one-to-ones. It's a private room. So, we do a lot of manual work to decrease their tightness, and then, to move on to their range of motion exercise and strengthening exercise. So we really help them out to get through their cancer journeys. Next slide. And this is our lymphedema therapy. So we offer the multiple different locations as well in a lymphedema clinics as well. We all certified as a lymphedema therapist. It's also one-to-one 60 minutes program that, in a private room that we work with the patients to work into get them decrease their swelling, and then educate, and then get them for the compression garments as well to finish their lymphedema therapy. Next slide. So this is, I just want to go over with it. So our physiatry, our cancer physiatry group also offers the breast cancer lymphedema surveillance program, which is patients coming in, and then we have a Sojo machine that we're able to detect how much patient has fluids. So patients are able to follow every 3 months and 6 months. They're going to be in a surveillance program to protect their lymphedema conditions.
We're going to ask questions afterwards, if that's okay, just so we have enough time. And, I'm just going to let you know, you can always email the program, put it into chat if you have any questions, and we can follow up with the participants as well.
Thank you.
Thank you so much, Soy. I really appreciate it. It was a really wonderful presentation. I'm just going to, give me 1 second. Go right into the other PowerPoint. Oops. Okay, give me 1 sec. Okay. Can everyone see that? Yes, thanks. Okay, so our next presentation is going to be Dr. Zhu. Thank you so much. And she's going to be talking about acupuncture and acupressure in cancer rehab. Thank you, Dr. Zhu.
Thank you. Nina, do you mind going into the presenter mode? It's
Sure.
so that we can have the full screen.
Yeah, give me 1 second.
You might have to click enable editing first.
Okay. Did that come up?
Yep, and then the bottom right corner, you see like a little, yeah, your mouse is, yep, the one next to it. You see how there's like a few icons? The one that's like a box with a line attached.
This one or no?
To right of that.
Okay, right. There we go. Thank you.
The one next, yes. Oh, great, perfect.
That
Thank you so much.
Of course. Thank you for letting me know.
Yes. Okay. So I'll be talking about acupuncture and cancer rehabilitation. I feel like acupuncture has been a really hot topic, at least in my medical community over the past few years. So I'll be talking a little bit more about what it is, what are the indications, and what are opportunities to use this for treatment of symptoms that cancer patients have. So we'll start by talking first about what is acupuncture. Next slide, please. So acupuncture comes from the practice of Chinese medicine. It involves the placement of needles into special points of the body called acupuncture points. These points are connected through meridians, which are thought to be energy pathways of the body. The purpose of the acupuncture is to remove blockages in these energy channels or to rebalance the energy in the body. In Chinese medicine, it's thought that all illnesses and ailments occur because of blockages or other abnormalities in the circulation of this energy within the body. Next slide, please. So what does acupuncture look like when it is actually being done? So our acupuncture needles are all sterilely packaged. They are regulated by the FDA. So they, typically we start by opening the package. The needles are packaged in tubes. So you can see the first picture in the top left corner. There you see a blue line with a cylindrical plastic tube around it. The needle is inside what we call the guide tube. In the second picture next to it, on the top right corner, the practitioner is putting the needle and guide tube in the position where they would like to insert the needle. Then they tap in the needle so that it is into the right spot, remove the guide tube, and then in the bottom right, they will push the needle into the desired depth. A common question I get from patients is this painful because the needle is going to the skin? The answer is surprisingly, actually, it's not painful. These needles are incredibly thin. They're more like the diameter of a hair rather than the needles you're used to seeing from blood draws. And patients sometimes do get a sensation of like a deep ache or electric shock at the moment when the needle is placed into the acupoint, but that sensation is very brief and goes away pretty much immediately. Typically, the needles, once they are in, do stay in for about 30 to 40 minutes per treatment. And sometimes practitioners will add electricity to those points as well to get electrical stimulation to help make it a more powerful treatment. And sometimes they can manually manipulate the needle and kind of twirl them in order to get some additional effects as well. Next slide, please.
Oops. Hold on a sec. Okay.
So now we'll be talking a little bit more about what symptoms acupuncture can be used to treat.
Oops.
Yep, next slide.
Ready? Okay.
Yes, thank you. So, So according to the National Center for Complementary and Integrative Health, acupuncture is recommended for a lot of different pain symptoms: back or neck pain, osteoarthritis, headache, migraines, muscle pain, sciatica, post-op pain, aromatase inhibitor-induced arthralgia. So those are for our patients who are on the exemestane or anastrozole or letrozole. You may find that you have a lot of joint pains, especially in your fingers, often in your knees, maybe even in your hips. That's a side effect from that medication. The acupuncture can certainly be used to treat this condition. And also cancer pain, which is pain directly coming from the cancer being a part of the body. Next slide, please. It can also be helpful for different non-pain conditions, such as seasonal allergies, urinary incontinence, which is when people have trouble holding their urine. So for example, if someone may feel that they need to go and they really need to go, that would be, something along the lines of that. Or if they're coughing and they find that, they're losing urine when that happens. Also, it's helpful for cancer treatment-related nausea and vomiting, as well as hot flashes. There are also some cancer-specific conditions it can be useful for. One of them is chemotherapy-induced peripheral neuropathy. So what this is a fairly common treatment side effect of chemotherapy used for breast cancer, as well as some other cancers. So for any patients who was on a taxane, like a paclitaxel, or a platinum agent, like a cisplatin or a carboplatin, this is something you may have experienced yourself. So this is that burning, tingling, lack of sensation, numbness that you can feel in your fingers and your feet as a result of the side effect of those chemotherapy medicines. One slide.
Sorry about that. Yeah, sorry.
That's okay. Also, it can actually be helpful for cancer-related fatigue. So a lot of our cancer patients, when they're on treatment or after treatment, can feel, just absolutely exhausted, wiped out. They feel like even doing something basic like taking a shower can just, make them feel completely exhausted. Acupuncture can actually be helpful in those cases to help restore energy. It can also be helpful for brain fog, also known as chemo brain. For some of our patients who are on chemo that feel like they're not as sharp, or they're scatterbrained, or they feel like they're having trouble concentrating, right? Those are all kind of symptoms of what we call chemo brain. And then also for leukopenia, which is low white blood cell counts. So white blood cells are part of, their blood cells in our body that are in charge of fighting off infections. So oftentimes they can, we can have, that's why often if you hear your oncologist tell you, oh, you're a high risk for infections, or your immune system isn't as strong right now, please take precautions, be careful. It's because your white blood cell counts are low as a result of the cancer treatment. All right, next slide, please. So, we talked about the traditional Chinese medicine and theory from there, but, in Western medicine, before we offer interventions to patients, we want to have evidence and proof and studies that these treatments actually work. So there is actually also Western medicine evidence behind acupuncture interventions and how they are helpful. Next slide, please. So acupuncture, like I mentioned, has definitely become more and more of a hot topic. There are a lot of different researchers who look at the effect of acupuncture in patients. They compare patients who take the treatment versus ones who don't, and that's kind of how they determine whether or not this is something that is really working. In this study in particular, the author just looked at currently published studies about the use of acupuncture in cancer patients. And based on their review of the currently published literature, they found that it was useful for a host of conditions, including chemotherapy-induced nausea, vomiting, cancer pain, post-operative pain, post-thoracotomy wound pain. So thoracotomy is lung surgery, when the ribs are kind of cracked open in order to kind of get into the lungs underneath. Hot flashes, chemotherapy-induced leukopenia, again, that low white blood cell count we talked about before, post-chemotherapy fatigue, and radiation-induced xerostomia, which is dry mouth. So the dry mouth is a side effect that so a lot of head and neck cancer patients get after they get treatment for that area. Of course, you know, if that whole area of the body is being treated, then some of the healthy structures that in the way of the treatment, such as the salivary glands get damaged, and as a result, they have dry mouth, which is a very uncomfortable condition. Next slide, please. So in this study, again, the authors looked at currently published literature to see if acupuncture was helpful for breast cancer patients specifically who had received surgery already but were still on, you know, prolonged treatment for their breast cancer. And they did find that it was helpful for nausea and vomiting, for appetite stimulation, for both constipation and diarrhea, for chemotherapy-induced peripheral neuropathy, again, that numbness in the hands and feet or burning in the hands and feet. That's a side effect of chemo. And aromatase inhibitors associated joint symptoms. So again, our patients who have the joint pains because they're on like letrozole, anastrozole, exemestane, as well as patients with cognitive impairment, so chemo brain. Next slide, please. In this one, the authors looked at published studies about acupuncture for the treatment of various cancer treatment-related symptoms to see if it was helpful for any of those. And they found that it was helpful for cancer-related fatigues, hot flashes in either breast cancer or prostate cancer patients, which, you know, that's a common side effect from treatment for both those cancers, the low white blood cell count again, and dry mouth. Next slide, please. And another study, again, you know, to reiterate, acupuncture was helpful for pain as well as for fatigue. Next slide. And also, they also found that it was helpful for anxiety and depression in cancer patients as well. And one of the really great things about acupuncture is that, you know, there really are not any side effects. So compared to medications that you might take for these different conditions, you're not worried about drug interactions with your other medicines. You're not worried about these like sometimes unsavory side effects that some patients can get. So it really is a very safe and well-tolerated treatment. So it's a great tool. Next slide, please. So, you know, we learned about how it can be helpful for all these things, but it's not necessarily the right treatment in all cases and for every patient. There are a few cases where we do have to be careful, or a few cases where it would actually be not the safest option. So we'll kind of talk about when we would not recommend acupuncture. Next slide, please. So the first one is pregnancy. It's not dangerous to do acupuncture in pregnancy in and of itself. However, there are certain acupuncture points which can actually induce contractions and childbirth. So when acupuncture is performed in pregnant patients, you have to be very careful not to stimulate those points if that is not the desired purpose of the acupuncture. Conversely, that also means acupuncture can be used to induce childbirth in patients who are kind of, you know, past their due date. But if that's not the case, you know, you have to be very careful about which points you're using and not using. It's also not recommended to do acupuncture in patients with uncontrolled movements. Of course, you can imagine how if you have a sharp uncovered object and someone who's not controlling their movements, that needle might go somewhere it's not supposed to go or was not the intended location. So it would not be recommended to do acupuncture in these types of patients. It's also not recommended to put any needles into a limb that has lymphedema. If anyone has lymphedema, you've probably heard from your doctor that you shouldn't get your blood pressure taken on that limb, and you also should not have any needle sticks on that side. And all of that, you know, is because the lymphatic system of that limb is not working well. And the lymphatic system is part of the immune system. So when it's not working well, you're at higher risk for infection. So you definitely don't want to be putting any needles or sharp objects or things there. And that's also why, if you heard Soy talk earlier, you know, she mentioned having good skincare. It's the same thing. You don't want your skin to become dry or cracked and give an opportunity for external bacteria to invade your body through those areas. Another time when we do not recommend acupuncture is in cases of spinal instability. So spinal instability typically occurs when the spine is not articulating well, either from the bones or from an issue with the bones or the ligaments. Typically in those cases, what is holding the spine in place is the muscle strength and muscle tension of the muscles around that joint. In acupuncture, the muscles become very relaxed and kind of loosen up, which helps give acupuncture some of its pain relieving properties. However, if those muscle tension is the only thing keeping the joint together, you certainly don't want it to become looser. So it is not definitely contraindicated in cases where there is spinal instability. Also in cases of low platelet count, so platelets are these blood cells that we all have. Their job is to make clots, right? So the reason why if we bleed, we don't bleed forever is because our platelets are making clots and stopping that bleeding. Now in patients who have low platelet counts, you might find that you bruise easily, you have prolonged bleeding because the clots are not forming well. So in those cases, you definitely do not want to introduce any sharp object to the body that can cause bleeding because that patient will have hard trouble their body will have trouble stopping the bleeding on their own. Also in cases of active infection, right? So for example, if someone has infection in their arm, you don't want to put a needle through that infection because that area has bacteria that's trying to attack the body. You put a needle through it, you're actually carrying the bacteria from that one area to a different part of the body that was maybe previously uninfected and healthy. The next one is severe neutropenia. So this is when your white blood cell count is extremely low. So there's no really evidence of the actual effect of acupuncture in these cases. So I would say it is more of a theoretical risk factor. But if in cases where the patients are severely immunocompromised, it's really just in general, we have to be 110% careful because the last thing we would want is to cause any harm or danger to any patients. And in cases where patients have pacemakers, we do not recommend electrical stimulation. So how pacemakers work is that it basically sends an electrical signal to the heart to help the heart keep on pace. So you don't want to introduce any external electricity that could possibly interact with the function of this very, very important medical device. It is still safe to needle these patients without electricity, just don't use any electricity with the treatment. Next slide. So, we live in America. So the next big barrier in everyone's healthcare, of course, is insurance companies, right? I'm sure we all had times when we wanted to get a certain treatment or certain medication, and then insurance tells you no. So that is certainly the case when it comes to acupuncture treatments as well. I put together a very brief list of a few insurance companies and kind of what they will cover in terms of acupuncture treatments. This is by no means an exhaustive list. And if you're interested in acupuncture treatment, I would recommend calling your insurance company and asking them exactly what do they cover in terms of acupuncture. Next slide, please. So the first insurance company I'm going to be talking about is Medicare. Medicare is the largest insurance company in the United States. Obviously comes from the government. Many patients do have this as their primary insurance. So Medicare Part B will cover acupuncture only for the diagnosis of chronic low back pain. Just that one diagnosis and nothing else. So obviously they have a lot of catching up to do because we saw how helpful it can be for all sorts of other conditions. Next slide, please. The next one is Cigna. So Cigna definitely covers more than Medicare. They cover for tension type headaches, migraine headaches. So basically all the types of headaches. They cover for pretty much any kind of musculoskeletal joint pain anywhere in the body. They also cover for nausea associated with pregnancy, chemotherapy, or surgery. Next slide, please. Aetna covers a little bit more than that. They also cover for pretty much any kind of musculoskeletal pain. They also and then as well as nausea. The additional thing they cover compared to Cigna is that they also cover for TMJ. So that's when you have the locking, tightness, pain in your jaw. But again, like we see, all these insurances, still has a very limited list of diagnoses they cover acupuncture for compared to all the things that acupuncture can be used for. And there are even more insurances who actually doesn't cover acupuncture at all, unfortunately. But hopefully that will change in the future. Next slide, please. All right, so in the next part, we're going to be talking a little bit about acupressure. So if you think about the word acupuncture, right? Acupuncture, the puncture part indicates the needle. We are puncturing through with the needle, the acupoint, which is what gives you the effect. So acupressure is you're using pressure instead of a needle to stimulate these points called acupoints, which are thought to have these different beneficial effects on the body. So we're going to try and exercise together, and this is something you can do on your own and for yourself. Next slide, please. So the point we're going to do together is called LI4. It's also known as large intestine 4. This point is helpful for headaches, including migraines. So if headaches is something you suffer from or your loved ones suffer from, next time you feel a headache coming on, you can do acupressure yourself on this point. It's also good for pain in general. It's also good for regulating the bowels, for constipation and diarrhea, for hangovers, and for anxiety. This is one of the points that I absolutely do not recommend using if you are pregnant, unless you are trying to speed up the birthing process. So if you're pregnant, please don't press on this point. So to do this exercise, so you're going to take one hand, either one is fine. You're going to kind of make this V shape from your thumb to your index finger. You're going to find the base of the V, and you're going to use your other hand's index finger to slide down. You're going to feel a divot here. So you can kind of, as you slide down from the base of that V, you're going to feel a divot. You're going to put your index finger on one side and your thumb on the other. So you're kind of making like a little clamp around that point. And then you're going to press down hard and give it a little massage. If you're on the right point, you should feel a deep ache on that spot that you're gripping. So you can also try it on the other hand. Again, make a V with your thumb and your index finger. At the very bottom of the V, slide down with your other index finger until you feel a divot in your flesh. It's kind of soft there. It's kind of, the picture on the slide kind of shows you where the point is. You're going to put your thumb and index finger around that point, and you're going to give it a squeeze and a massage. And if you're on the right point, you should feel a deep ache right in that spot. All right, so we're going to move on to the next slide. So I do have some resources of acupuncture practitioners in New York City where I practice. Next slide, please. So my name is here along with the names of many of my colleagues who also perform acupuncture as part of their practice. And next slide, please. These are some licensed acupuncturists who are out in the community, again, in New York City. This list was compiled by one of my colleagues who has been practicing acupuncture in the area for much longer than me. Next slide, please. And that's it for me.
Thank you so much, Dr. Zhu. I really appreciate your time, and I love doing the exercise as well. I hope everyone enjoyed it. Are there any, let me just look for questions. First question I see is, have you seen evidence of increased WBC count with acupuncture? You have to be unmuted. There you go.
Yes.
Okay.
Yes, I was going to ask to be unmuted. Thank you. So there are actually multitudes of papers that show that acupuncture did help increase white blood cell count. I would say my personal practice, no one has ever referred me a patient for this purpose, so I have not done it personally.
Thank you. Are there any other questions that anyone has? Here's another one. It says, can acupressure help with increasing bone density?
Unfortunately, I don't think acupressure helps with increasing bone density. The best thing to do in terms of bone density issues is really to do weight-bearing exercise. So things like walking can be very helpful. Sometimes there are also medications that endocrinologists or oncologists can prescribe that can help with bone density issues. But I do not think acupuncture or acupressure works for this indication.
Thanks. Another question that came in is how is this improving cognitive function?
So this is a really interesting part, right? Like how does acupuncture work? And I think this is a often talked about, topic. So from a Western medicine standpoint, there's a few different theories about why or how acupuncture works, right? Because we have evidence it works. Now we're just trying to figure out how or why. There's one theory that acupuncture promotes the secretion of beneficial neurohormones. There's another theory that acupuncture actually promotes the secretion of certain electrolytes in certain pathways that then help block pain channels. Neither of those explanations 100% explain all the things that acupuncture is effective for. So I would say, honestly, we do not know exactly how it works. But in terms of improving cognitive function, it's the same thing, right? The studies show that it works, and then they kind of talk about which points. And then when they tested the patients, what the group that was on acupuncture did better than the group that was not.
Thank you. Are there any questions for Soy as far as the lymphedema massage at this point? One thing that I noted to Soy before we started, a lot of people are unaware that you have to switch your lymphedema sleeve every 6 to 9 months. And the good news is that it's starting to get covered by insurance. And is there anything else that you think is really important to share that people might not know about?
So basically, the compression is going to be key. So they have to compliance with the compression garments. That's one of the biggest things. They have to watch out their skin cares. Because actually, if a lot of patients, our returning patients, about 5 to 10%, the reason that they are coming back is non-compliance to the compression garments. So as soon as they took it out, and then they start not wearing it, and then they start to notice an increased swelling, and then they get desperate and they start to put it on, but it's already too tight. So basically, it's really important to being in a compliance with the compression garments, because they will help out to improve their skincare also, and they will help out to decrease the risk of getting any infections. Because the way that the swelling is increased, then they're getting more high risk of getting infections or cellulitis or dry skin. And then it leads to the open wound, and then it's just go on and on with this. So basically, it's very important to manage it. And then also there's a high relationship between their weight, unfortunately, with with their lymphedema condition. So we don't want to continue their exercise and then manage their weight. Once they decrease their weight, and then it really helps out to manage the swelling a lot more better. That's what I've been seeing with a lot of my patients. And also, once I've been seeing one of my patients, she lost about 25 pounds, and then her swelling is significantly improved. Her skin's condition is much, much better. So
that's great to know. Also, here's another question for you. Will the lymphatic flow improve over time and reroute where I do not have to worry about getting lymphedema?
So, basically, once they exercise, they will help out with it. The lymphatic, the biggest lymphatic driving force is the muscle pumping. So when they do exercise, the muscle will pump it at the fluids. They will help out to reroute the fluids and then helping out with it. So it's really, really important to continue to exercise a lot of pumping exercise, such as walkings, a bike. Any like aerobic exercise also will help out to manage improve their lymphatic systems. Also, they can do a lot of deep breathing exercise. We have a lot of lymph nodes around the belly area, and then they will stimulate their lymph nodes. And then once they do a lot of deep breathing exercise with the stimulation of the lymphatic systems, then the study shows that it will opens up to 72 hours. So, they do a couple of times per week, and then they will really help out to reduce the fluids. Unfortunately, our lymphatic system is not reversible. So once they get the lymphedema condition, there's no return. So it's important to keep, monitoring their symptoms or signs. And then as soon as they know about it, then, they should talk to the doctor. Even though the swelling is, because a lot of our patients comes with a lot of swelling because they kind of neglect their conditions for a while. And then once they get worse, then they come to start to see the doctors. So before that, they have to monitor it. And then if it's a very mild lymphedema, then definitely possibility that, it can be managed much better, or it can be reversible.
Here's a question about travel. Is there anything patients can do to prevent lymphedema? In addition, do you recommend wearing any type of compression sleeve for flying? You have not if you have not yet been diagnosed with lymphedema, but are within a month of surgery. So it would be preventative.
So, there are a lot of different controversy with the, wearing of compression garments for traveling. So what we usually recommend for the patient, if they don't have a lymphedema, then they don't have to wear the compression. Because compression is basically, they really limits the, to not to get accumulating swelling. But, they don't have a swelling, then they don't have to wearing it. And then, if they do have a mild swelling, definitely we recommend the patient to wear the mild compression sleeve, about 15 to 20 or 20 to 30. But, if they fly only 1-2 hours, then that's okay. We usually recommend for the patients who flying like more than 4 hours, going to the more like a longer flight, then definitely will help out with it. Also, for the lower leg, a lot of patients, wearing a compression stockings because of prevent the DVT, which is blood clot.
Thank you. And one other question. Does a lymphedema develop later in life, much later after
Yes.
treatment?
Unfortunately, it is. I've been seeing some patient after 10 years, they develop the lymphedema.
Mhm.
So it can be happens. Usually it should happen about 1 to 2 years after the surgery, but nothing is really guaranteed. Some patients who are going to the under chemotherapy such a long period of time can develop the lymphedema later stage. So there's really not timing of it, but I've been seeing some patients as well, after the long years
Thank
later.
you. And here's a question for Dr. Zhu. Is there an acupressure point that might elevate white blood cell count? Yeah. Trying to get to Dr. Zhu. Hold on a second.
Okay, thank you.
There you are. Okay.
So the treatment for the low white blood cell count is actually quite involved. It involves many different points. And generally speaking, acupuncture is thought to be a more powerful treatment than acupressure just because we're able to get deeper into the points. So unfortunately, there is not one specific point that I think would be extremely helpful for just on its own for increasing a white blood cell count.
Thank you. And here's one other question. In your experience, what is the best time to receive acupuncture, i.e. day before, day after chemo? Is there any specific time that seems more beneficial than others?
So it depends on what you're receiving the treatment for, right? So if you're receiving it for chemotherapy-induced nausea, vomiting, generally speaking, patients know which day that their symptoms are worst. The result from the acupuncture treatment is usually pretty immediate, and how long that lasts kind of varies depending on the patient, depending on how many sessions they've received so far. Generally, the more sessions you've done, the longer the effect of the acupuncture treatment lasts. So if you're getting chemotherapy, and then you're gonna have side effects from it, and it's typically the side effects are worst, say on day 3 after chemo, then you probably want to get acupuncture either on or right before day 3 of chemo, so that the effect of the acupuncture overlaps when you have your symptoms.
Thank you. I know that's very helpful for a lot of patients. Here's another one for you. Are there specific points in acupressure to relieve hip pain, knee pain when it flares up?
Again, for these conditions, the treatment is also quite involved. So there are a series of points for the treatment. I would say it's difficult just to do acupressure for those specific points, or for those specific conditions. It's better just to receive a full treatment.
Thank you. Does anyone have any further questions for either of our amazing presenters at this point? Okay, well, I can't thank both of you enough. This was a wonderful way to spend the lunch hour. Oh, we just got a new one. Does Medicare pay for acupressure?
So that I do not know. Generally speaking, if someone does acupuncture treatments, they will just put the needles in and do acupuncture. Acupressure is something if we're done, I would say is taught more to patients to do on their own in between acupuncture sessions for some additional effect. Again, my experience is the acupressure effect is smaller compared to acupuncture and doesn't last as long.
And I love that you did an exercise with us. It was really helpful so that everyone knows, you know, and you can go back and watch this forum and see exactly how to do it as well. One other question, are there specific physicians dealing with letrozole as far as acupressure? I think, is that the same question?
So I practice cancer rehabilitation. So I treat patients for all these side effects from the cancer treatments and from the cancer. So I do see patients on side effects of letrozole, and my management, it's not just acupuncture, it's medication management, it's therapy prescriptions, it's acupuncture if that's appropriate for their condition. So I kind of address everything related to the side effects of, for example, anastrozole.
And I know you're located in New York City at NYU. You don't know of any providers that are in Suffolk County, do you?
Out in Long Island, my colleagues at Northwell do take care of the patients, same type of patients for the same conditions. So, and
Beautiful.
I saw in Soy's presentation, I recognize a lot of those names. Dr. Patrick Martone, Dr. Sue Maltzer, Dr. Chanel Davidoff, I think is also in Manhattan, but Dr. Martone, Dr. Maltzer, I know are out in Long Island.
That's great. There's so many different options and people to go to. Thank you so much. In a couple of seconds, one of my colleagues is going to put a survey into the chat. And please take the time to fill it out. This will help us with future forums that we are going to be presenting. We love to hear your feedback. We would love to hear what ideas you have about forums that you're interested in. And I cannot thank both of these presenters enough. It was a really wonderful presentation, very educational, and I wish everyone a wonderful day. Kim, are you going to be adding the evaluation? We just got another thank you, Soy. Dr. Martone in Bayshore does acupuncture, if someone's looking in. Here we go. Kim just added the evaluation. You can download it and answer any questions. I can't thank all of you for participating and spending the time with us, and have a wonderful afternoon.